Can artificial intelligence combat COVID-19? Hello world, from Brooklyn, New York. This is Dr. Lowell Sala of NYC Emerging Healthcare Technology, up for another episode of Health and Technology. The COVID-19 virus has spread and is now a major global health emergency. This novel coronavirus, which started in Wuhan, has now resulted about 472,000 deaths as of June 23, 2020. With confirmed cases of around 9 million people globally, a Canadian AI company, Blue Dot, was actually one of the first companies to alert the world after a first case was identified. Using an outbreak AI risk software, Blue Dot published a scientific paper predicting its global spread and warned its customers on December 31. It was also substantial in predicting the spread of the Zika virus in Brazil. Another AI-based model of health map, a Boston Children's Hospital, sounded the first alarms on December 30. It should be noted, however, that AI requires substantial data to train, and currently, the whole picture of COVID-19 is still incomplete. Hence, recommendations should always be taken appropriately. In a study on the early dynamics of COVID-19, it was revealed that the mean incubation was 5.2 days, with the 95th percentile at 12.5 days. This was the fundamental basis for the experts' 14-day quarantine recommendation. Artificial intelligence can be used to predict not just how COVID-19 will spread over time, but also identify factors relating to the success of quarantine measures. Is a 14-day quarantine good enough, or should we shift to other models? Artificial intelligence can also be used to identify potentially infected people in public spaces. It can also be used to assess if a PUI is wearing appropriate masks through facial recognition. Another aspect is to use AI for emotion detection. In the 2019 New York City Angel Hack competition, our team was runner-up in creating a platform for detecting simple emotions such as happy, anger, and fear. AI can also be used in the diagnosis of the disease. However, since there is still a dearth of training data, the algorithms are far from perfect. The context of bias is another aspect that needs to be discussed, as algorithms are only good with respect to the data provided. The CDC website, through its partnership with Microsoft's Azure platform, makes use of a coronavirus SelfCheck named Clara. Clara is very helpful in providing the community some knowledge in who should get tested so as not to overwhelm the healthcare system. It is also important to refer only to reputable websites, as fake news is rapidly proliferating the internet. AI has been used to identify potential drugs long before the COVID-19 pandemic. AI algorithms can be trained and the resulting models used to screen existing drugs that demonstrate effectiveness against the virus. Pharmacological compounds can be screened in a short time, allowing possible treatment candidates. Healthcare and pharmaceutical organizations need to utilize these emerging technologies to combat this deadly pandemic. Although the role of artificial intelligence is yet to be quantified, some platforms do identify potential solutions. We still have a long way to go in understanding the COVID-19 virus in terms of its behavior and susceptibility. But at least with the AI, we can fast-track some of those factors just long enough for our species to survive and to thrive. And that is it for today. I would like to end by saying we should always follow evidence-based scientific recommendations. See you next time.